Hello, I'm Linnet Carty, and it's great to be back after a little bit of a break, back for the summer season. We got an eye-opening show for you today. Please put your hands together and join me in welcoming our own optometrist from here in Connecticut, Dr. Monique Dawson. Welcome.
Thank you for having me on the show.
Glad to have you. So, Dr. Dawson, let's jump right in. Our audience members and everybody have lots of questions about what to do. So first of all, what's on your I-do list for a typical routine eye exam? What does that entail?
That's a great question. When I'm examining someone's eyes, the first thing I do is gather information about what brings you in for the eye exam, what it is your vision, what it is you have to do for the day, how you spend your time, how you're using your eyes. Do you spend time on a computer? Are you doing a lot of reading or driving? So I check your vision. I have you stand 10 to 20 feet away from a chart and read, checking visual acuity at both distance and then at near, along with any eyeglasses or contact lenses you may already be using.
20/20 vision, that's what brought me to you because first of all, my arms just weren't long enough anymore. You guys holding the paper for me. And I remember one evening I was sitting watching TV and I saw this black dot like on my carpet and I was like, oh my gosh, what is that black dot? I hope it's not a bug. And I got up and it was a corner. I knew I needed to come see you. I ran to come and see you. So what is 20/20 vision and what happens when you start to lose that 20/20 vision?
Okay, well the term 20/20 specifically means the top number 20, you're standing 20 feet away from the acuity chart, and then the bottom number 20 actually is the measurement of the size of the letter that you're reading. So as the numbers are increasing from 20/20 to 20/30, 20/40, and 20/50, 60 up to 2400, that means the size of the letter is now increased from 20 to 30 to 40. We used to use a measurement called minutes. So it's a unit like centimeters or millimeters. Your 20-minute letter you can see 20 feet away. Someone with low vision can only see a 2400 letter 20 feet away.
Okay, so I guess it's similar to a font on a computer.
Yes.
I used to be very comfortable at 12, now I'm at 26. Okay, so please describe some of the differences between nearsighted and farsighted.
Great question. When someone's nearsighted, it means exactly what it's saying. You have sight and see very well up close, and you need glasses or contact lenses to clear your vision for distance. Like I was talking about the 2400 letter, most people who are nearsighted without glasses or contacts can only see that size letter. But with contacts or glasses, they're able to see down to 20/20. So if you're farsighted, you can see that 20/20 letter without glasses, but up close you have trouble seeing. So you have sight for far if you're farsighted, and you need glasses for reading.
Okay.
There's another term called presbyopia, and that's the need for reading glasses once you hit age 40 or so.
Mm-hmm.
And that's a normal aging change, not an eye disease or a misshape to the eye. When you're nearsighted, your eye's a little longer than average. When you're farsighted, your eye's a little shorter than average. And then the presbyopia kicks in when you start to have difficulty focusing up close and you need reading glasses.
Okay, yeah, so that's me. I need reading glasses. I can see really well far away, but up close, if the font is too small, I have a problem, so I do use them for reading. So describe a little bit the difference between contacts and glasses. And I know some people wear what they call the graduals or bifocals,
Yes.
and does that come in contacts? And which is better for people that have nearsighted and farsightedness?
Well, depending on your diagnosis, if you are nearsighted or have myopia, you're going to wear your glasses or contacts for distance, and typically under the age of 40, we can focus through that to see up close. So you can wear the contacts all day or your glasses all day. Same is true for farsightedness. Presbyopia may create a little difficulty in wearing contact lenses for distance because now you need something for reading. So you can have single vision glasses or contact lenses to clear up your distance or your near vision, but then you'll have to add on glasses on top of your contacts if you need them for reading, or they do make bifocal contact lenses.
Okay.
Bifocal eyeglasses are available with a line. Those are very traditional, standard, what we call flat top bifocals. There are no line or progressive lenses, and that's where you have a gradual change from the distance prescription down to the reading prescription that allows you to see far, near, as well as the intermediate. And that way you can see your computer, things on a countertop or a table, the dashboard in your car, without a line right in the center of your vision.
Okay, that makes sense. That makes sense. So let's talk a little bit about the testing.
Okay.
First of all, why do doctors dilate your eyes?
That's a good question.
And describe what happens in the dilation process for those of you that haven't had it done.
Right. Well, a dilation is where you'll have drops put in your eyes to numb the cornea, and then those drops that follow take the iris, the colored part of the eye, and open it wide, and that is really opening the door or the window into the eye so that the doctor can look in to the retina and to the back of the eye to really get a good look at the structures of the retina, the blood vessels, the optic nerve, the macula. And that's where changes from glaucoma, macular degeneration, high blood pressure, or diabetes can really show up and can really give us a greater view into your body's general health. So it really is important to have your eyes dilated periodically. I like to dilate at the first eye exam and then maybe every 2 or 3 visits after that.
So what is the puff ear test? I don't like that one, where you get really close and your eye is almost held open and you get that puff of air.
That's one way of measuring the pressure in the eye.
Okay.
The puff of air test is a machine that expresses a calibrated amount of air towards the eye, and it measures the amount of air returning to it, giving a millimeters of mercury measurement on the other side for the technician or doctor to then evaluate your risk for glaucoma. There are a number of other factors that go into determining if someone has glaucoma, like the appearance of the optic nerve, the thickness of the cornea, the center and the blood vessels. So that's just one factor.
Okay. Let's talk a little bit about depth perception and peripheral vision, and how does that play into your testing?
Well, depth perception has a lot to do with how we use both eyes together. We can have very clear 20/20 visual acuity in each eye, but together the eyes may have difficulty working, and that will show up in the inability to perceive depth. One of the tests that we have in the office can evaluate your depth perception. Often if you go to an IMAX theater or a 3D movie, you'll be able to wear special glasses that are stereoscopic and allow us to separate what each eye sees, and then you get a greater amount of depth apparent in the picture. If you have a difference in prescription or a difference in vision between the eyes, then you'll find that the depth perception isn't as pronounced as it would be for someone who uses both eyes together.
Okay, and what about color vision?
Color vision is related to the health of the retina, and when you have really strong color vision, you don't typically need any visual aids. But for someone who has color deficiency or color blindness, there are contact lenses, a special red lens that someone can wear to help them in perceiving colors, and I fit patients with that successfully.
All right, well, we're going to take a quick break right here. When we come back, we're going to hear more from Dr. Monique Dawson at Vision Partners in Meriden, Connecticut. But coming up next, you'll hear from the JPJ Band, who played at Bloomfield Village Pizza. They were awesome. Take a look. I'm Linnet Carty, and wasn't that band awesome? That was the JPJ Band, and once again, they played at Bloomfield Village Pizza. They were awesome. Coming up back with us is Dr. Monique Dawson, and we're going to continue our conversation on eye care. So Dr. Dawson, please let's talk a little bit about the equipment that we see here.
Great. One of the things that we check is a rough estimate of your prescription, and it's done with a machine that's called an autorefractor.
Okay, so this is an autorefractor here.
And a patient just sets their chin in the chin rest, forehead up to the forehead bar, and looks straight ahead, and they see a target. And an image is presented that gives a rough estimate of the prescription along with the shape of the cornea.
And what's the next one?
This is the ear puff test that you asked about earlier. That gives.
I don't like that machine. I don't like it.
It gives an estimate of the pressure in the eye, and there are alternative ways of measuring the eye pressure. We have.
Oh, that's the one where they touch your eye. Actually,
Yeah.
That's worse. I'll take the ear puff. It's horrible. It's horrible. Describe that.
Well, with this, we do apply drops that numb the eye, and then a blue light comes close to the cornea and actually touches the front, but you don't feel it because the eye is numb.
But you know it's coming. Hold your eye open. Just let somebody say, "Yeah, I'm going to put my finger there," but you won't feel. I'm going to just touch your eyeball. That's crazy.
Well, it actually gives the more accurate reading as
Okay.
opposed to the puff of air. It can sometimes be a little uncomfortable to sit for, but it is very reliable.
Okay.
If you wear contact lenses, it can be a bit of a nuisance because you really can't put your contacts right in after having it done, but you plan ahead and bring your glasses.
Okay. All right.
It's attached to an instrument that is a microscope, and this microscope allows me to see details of the eye from the cornea all the way to the retina.
Okay. And what's this segment?
This is called the keratometer, and it is used often in measuring the shape of the cornea, especially for contact lens fitting.
Okay. Is there any other equipment you'd like to show us, just to terrify our viewers so they don't go and get their eyes checked?
This should not be terrifying at all. This, I think, is the most pleasant piece.
Okay.
It's full of lenses. It's called a Phoropter,
Mhm.
and it's just like a giant pair of glasses. This is where I shine lights in through to check the eye's reflection of light and change the lenses to determine your prescription. This is a Bio-Microscope slit lamp, and it's used to check the health of the eyes. We check the cornea, the lens, the iris, through the pupil to the retina.
Great. So for those parents out there, how can they tell if their child needs glasses or needs a prescription? What are some of the indicators for that?
One thing you would definitely want to watch for is if you see your child squinting, rubbing their eyes excessively, standing in front of the television very close, and you tell them to sit back or you pull them back and they walk forward again. If they're having trouble in school, those are some of the indicators. But it's really important to have your child's vision tested, even if you don't think there's a problem, because there may be one underlying that you're simply missing,
Okay.
or that the pediatrician doesn't pick up.
At what age should be the first eye exam?
I would say entering school is
Okay,
a really
at least,
important time.
yeah.
Yeah, at least.
Around 4 before they go to
Yeah,
preschool.
Exactly.
Okay.
Yeah, but I start at age 3 and up, and there are specialists that see infants.
Okay. So what causes dry eyes? I have a friend that wears contacts. She constantly gets dry eyes. What causes that?
Dry eyes occurs when the gland in the upper lid doesn't produce tears as it should,
Okay.
and it results in a very uncomfortable, sandy, gritty-like feeling. And as we age, normal aging changes, our bodies just produce fewer tears. There are drops that can help simply to add moisture to the eye, like artificial tears, and then there are prescription drops available if just adding a simple lubricant doesn't help. The prescription drops do take time to start working, so you really have to be committed and dedicated to their use, but we find that there is relief once you stick to it.
So is contacts somewhat the cause of this, or can people actually have that without the contacts? They can have dry eyes.
You can have dry eyes without contact lens use. Contact lens use can sometimes exaggerate it, make it worse, exacerbate it, but often with use of the drops, you'll get relief.
Okay. So what are some of the illnesses that are, affect the eyes? I know diabetes is one. Can you talk
Absolutely.
about some others? You talked about when you dilate and you can
Yeah.
see. what illnesses might be reflected in that exam. Can you
Right.
speak a little to that?
Sure. Hypertension.
Okay, which is high blood pressure.
Yes, you can
Okay.
have blood or fluid leakage in the retina in the back of the eyes. With diabetes, you can also have blood vessel growth and blood leakage in the back of the eye. You can have extra blood vessels growing even on the colored part of the eye, the
Wow.
iris.
Okay.
And
you know right away, that's a signal right
yes,
away.
that's a direct sign
Sign,
that
okay.
someone may have diabetes. And there are times when during an eye exam, that's when the first indicator is noticed.
Oh, when they find out. Ooh,
Yeah.
ouch. Yeah. Okay. So get your eyes checked, please, people, because I know, especially for our culture, that diabetes, the sugar, as we call it, sometimes is prevalent. So that's a good
Absolutely.
way to get that diagnosed.
Sarcoidosis,
Okay.
lupus, those are other conditions
Oh, wow.
that can show up in the
Lupus.
eye.
Okay.
Yeah.
All right. And it has the same thing with the veins, or
Different, no, you can have inflammation in the eye. Often, someone may have a very painful red eye, and it's a result of having inflammation in the eye.
Okay. What about thyroid? I hear people mention thyroid illness, and that you can tell the eyes, I guess, get bigger.
Yes, the thyroid eye disease is where the muscles in the eyes start to swell, and it causes a protrusion of the ocular globe, and the eyelids retract, and so the eyeball appears to protrude.
Okay, and it appears a little bit bigger.
Yeah.
Okay. All right, what are some of the medicines that affect the eye? I was on one for a while called Plaquenil, which is for arthritis. I guess the side effect is that it can cause you to go blind. But the other great thing about it is it doesn't affect anything else in your body. But as long as you get your eyes checked, you should be okay. So speak a little bit into some of those medications.
Yes, there are definitely high-risk medications that can affect the vision. Plaquenil being one of them. There are others such as medications for depression can affect the eyes.
Okay.
Allergy medications can affect the eyes and causing them to be drier.
That's where I was going next to talk about allergies. So it's a good segue.
All right.
Yeah, so let's talk a little bit about hay fever and the effects of pollen and things like that on the eye.
Well, if you're experiencing symptoms of itching, tearing, or redness, there are prescription eye drops that will alleviate them, some available over the counter and some by prescription.
Okay. What about crying? Actually, how does that all work medically?
Okay.
And tears come and,
Yeah.
how does that happen?
Well, our eyes need to be lubricated in order to see clearly. And the gland in the eye that produces tears keeps the eye moisturized. When we cry, it's considered a reflex reaction or reflex tear. So those tears that run from the eye have a higher water content compared to the natural tear that stays in the eye, which has a lesser water content, more of a lubricant, thicker viscosity, like an oily component and a fatty component.
Yes.
It's when we start to lose those components that we experience symptoms of dry eye.
Okay.
As our eye perceives that dryness, the brain says make more tears.
Tears, okay.
But the tear that's made is a reflex tear, similar to the one we use when we're crying. So it just runs, and it doesn't moisturize and lubricate the eye, so it just continuously runs. So often people with dry eyes have wet eyes, and they don't understand why their eyes are wet, and they have a
Okay.
diagnosis of dry eyes.
That's
And it's
crazy.
because of the balance of tears. You don't have a natural balance of water to lipids together.
All right, and I would imagine that there's medicine for that.
There are medications that can help the eye produce that natural lipid, more lipid-based tear.
Okay. What's an astigmatism?
Astigmatism is based on the shape of the eye, and it just means one area of the eye is curved or made a little shaped steeper than another. And we give an example of the shape of a basketball being completely round or spherical. That eye does not have astigmatism compared to the shape of a football that has a broader radius of curvature horizontally than it does vertically, a steeper radius of curvature, and therefore you need a different prescription in each area in order to see clearly.
Okay. All right. So we have about 2 minutes before we wrap up. I know people at home, glasses are in now. I see that they're coming back. It was contacts, the colored contacts, and now all of a sudden, you know, with laser, I think, if you're not getting the laser, that, you know, glasses, the newest frames are in. So what sorts of frames are best for the different types of shaped faces, for oval, for oblong face, for a heart-shaped face, and so on?
Great question. It really depends on the individual. A lot of your features will play a part in your frame selection, along with the shape of your face and the shape of your eyes, the distance between each eye. We have a wide array and variety of frames to choose from, and I think it's really important to personally hand select your glasses
Yes.
and be able to try them on. That way you'll get a good idea for the comfort and the fit. I tend not to even want to shop for clothing or shoes by mail. I definitely wouldn't do that.
Yeah, you want to
with
try it,
my
right.
contacts.
All right, so in 30 seconds, speak a little bit just to laser surgery and how that is new on the horizon for people that are willing to go under that surgery.
Yeah, it's been available for a number of years now, and the results now are holding steady. People who've had the surgery done still have very good vision. I think it's a good procedure and something to consider if your vision is stable and you're uncomfortable with glasses or contacts. Laser surgery is an option. I also like to point to the importance of eating a well-balanced, healthy diet that is high in nutrients that keep the eyes healthy, and having a healthy lifestyle, not smoking. Those are things that can lead to cataracts or macular degeneration.
All right, thank you so much, Dr. Dawson. It's my pleasure to have you on the program. And for those of you at home that might know me, yes, this is my little sister, Monique. So I'm so proud of her to have her on. Thank you guys so much for watching. I'm Linnet Carty. Thank you to my crew, to our director, Jatu Huntley. Also, we have a new intern, and her name is Taylor Jett. She's here with us today. And also for the guys that, you know, really are the backbone of this and helping me put all the cameras and everything together, to Armando Torres and Miguel Vasquez. Thank you so much to the crew. My name is Linnet Carty. I'll see you on the next program. Have a good one.